Carter, and I'll be your student nurse today. And I would like to perform a head-to-toe assessment on you. Would that be okay?
Yes, ma'am.
All right. Can you state your name and date of birth for me, please?
Taja Davis, 5/23/1999.
All righty. Thank you. All right. I'm going to start with your head, ma'am. Her head is round and almost cephalic. There's no signs of lesions or parasites. Her scalp is dry and her hair is evenly distributed. Alrighty, ma'am. We're going to check your temporal pulse. +2 bilateral. There's no signs of dehydration to her ears. Bilateral. We're going to check the inside of your ears, ma'am. Okay, there's no cerumen in her ears, bilateral. She has no drainage. There's no signs of edema. Okay. We're going to check your eyes. Open your eyes. Her sclera is white. Her conjunctive is pink. There's no sign of edema or no signs of drainage to the eyes. Her eyes dilated to 3 millimeters. They are round, equal, and reactive to light. We're going to check your nose. Okay, can you do this? Other side. Alrighty. Her airway is patent. Check the inside of your nose, ma'am. Her septum is midline. There's no sign of drainage or no edema present. Her lips are pink and dry. Smile for me. Her smile is symmetrical. I'm going to check your hands out of your mouth. So your tongue out, say, ah. Her uvula is present and it is pink and marsh. I can also see her tonsils. She has all her teeth and they are white. They are clean. There's no sign of edema. Alrighty, thank you, ma'am. I'm just checking her face, and she has bumps bilateral to both sides of her cheeks. We're going to check her carotid artery one at a time. +2 bilateral. Alrighty. Her trachea is midline. I don't see no breakdowns. No scars, no signs of edema. Alrighty. Capillary refill is less than 2 seconds. Her skin is clear. There's no signs of breakdowns or no lesions or anything, no scars. We're going to check your brachial. +2 bilateral. We're going to check your radial pulse. +2 bilateral. Alrighty. So now we're gonna perform a little range of motion. Hands in the air. Alright, she can perform full range of motion to her upper extremities. Squeeze my fingers, please. Push against me. Alrighty, her strength is a +4 to her upper extremity, bilateral. Alrighty. So now, Miss Davis, we're going to check your lungs. Breathe in for me. Okay. The lung signs are clear. Posterior, there's no adventitious sounds. We're going to check posterior. Breathe in for me. Breathe in for me. Out. Breathe in. Breathe in. Out. Her lung sounds are clear. There's no adventitious sounds. And at this time, I will assess her back. Make sure she don't have any breakdowns, no edema, or no lesions. Alrighty. Miss Davis, we're gonna listen to your heart sounds. Okay. Aortic. Pneumonic. Herbs. Tricep valve. Mitral valve. And I will listen to the mitral valve for a full minute. Okay. S1 and S2 is present. Okay. There's no heart murmurs. All right, Miss Davis, at this time I will assess her abdomen. Make sure she don't have any scars, any lesions or anything like that. Now I will listen to them, Miss Davis. Alrighty. Her abdomen, they are hyperactive in all four quadrants, but if I didn't hear anything, I will listen to each one for a full 5 minutes. I'm just gonna palpate. Do you feel any tenderness? Okay. Patient feels no signs of tenderness. Your bladder full?
Yeah.
Yeah. Her bladder is full. I can tell. Okay. And at that time, I would just assess the front of her, make sure she have no edema, no lesions, or no breakdowns or anything to her skin. Then I would check her femoral pulse, bilateral, popliteal, 2 plus bilateral, posterior tibia, +2 bilateral, and her dorsus pedis, +2 bilateral. And I will also check her capillary refill in her foot. Make sure we don't have any signs of edema or no skin breakdown or anything to your legs. So at this time, Miss Davis, we're gonna do range of motion. Can you leg out for me, ma'am? Leg out. Up. Up. So she can perform full range of motion to the lower extremities or whatever. Miss Davis, I'm gonna slip your shoes on. I'm gonna check your gait. Can you stand for me? Just take a couple steps forward, ma'am. Couple steps back. All right, have a seat. Her state is her gait is steady, and I will also check her strength in her foot. Just push down and make sure. Just push down. Okay. Alrighty, thank you, Miss Davis, so much for letting me perform a head-to-toe assessment on you. Have a blessed day, ma'am.
Thank you, you too.